All right, thanks for coming, guys. To whoever would like to respond, I'm curious what sort of harm reduction services there are for heroin addicts in New Hampshire. I've learned about some programs in Boston. I know they have one. And I'm just curious if we're doing anything like needle exchanges or safe rooms, things like that.
Okay, just as a start, some of the substance misuse programs that we're working with, particularly in Manchester, but they also have kind of sister organizations or branches throughout the state, are doing a lot of harm reduction in their outpatient programs. So recognizing that not all people are ready to commit to or even need a residential substance misuse detox program, a lot of these services provide outpatient where people are given opportunity to meet with a clinician and go to groups and talk about their process and how they can appropriately come off of the substances they're using, and that is a place where I'm talking to a lot of programs and I'm hearing that they're doing harm reduction and looking at what does safe use look like, what are appropriate resources, and how does the community support that. It very much depends on what people are using though, because harm reduction isn't relevant for certain substances. Yeah.
Thank you.
There is a program called Safe Stations in Manchester, which is a harm reduction. Is it statewide? Which is a harm reduction model where you can go to any fire station and be assessed, which has been pretty great at reducing overdoses in the places that are implementing it.
What's that called again?
It's Safe Stations.
Yeah, Safe Station. It's actually a statewide, and it's not unique. It's not just New Hampshire, but anyone can go to any fire department in the state at any time, any day, 24 hours a day, and say that they need help. So it's to really make the substance misuse kind of issue something that's less taboo and more safe for people to come forward. It kind of mitigates the legal, like people don't want to walk into a police station or be picked up by a police officer, so they can come in and have a conversation with someone from the fire department about where they're at. They do a brief medical assessment to make sure that they're safe and they don't need to go into detox or a hospital. And then each fire station works with a particular substance misuse program locally, and they facilitate that person. Either they walk them over or drive them over, or they have someone from that treatment program come and meet them, and then they organize a plan for them to receive treatment. And that's part of the harm reduction program. That's statewide in New Hampshire. You'll see it on most of the fire department websites.